So sociolinguists study language in society. And, just as a biologist would use their tools and disciplines to understand life in different settings, we have our ways of looking at parts of language all the way from different sounds to entirely different ways of approaching conversation and discourse, and how that connects to different social identities, different regions, geographies, all those sorts of things that make up society. So I could talk about, I could give you lots and lots of examples of how small differences in language reflect who people are, reflect how they want to be seen, what they're trying to get across, and how those differences, if we're thinking about them in terms of policy communications, really make a big difference in the world.
Welcome to Public Health Careers. I'm your host, Omari Richards, founder of the Public Health Millennial. We're going to dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies, get tips, while also learning from others to help you in your own journey and learning of public health. Learn about the vast world of public health careers, or just hear public health stories. Stay tuned so we can do our part towards a culture of health, well-being, and equity for all. Hey friends, welcome to Public Health Careers. In today's episode, you'll hear more about getting involved in public health from a non-traditional linguistic background, why public health needs more social linguistic, and the important role they play in framing health opportunities, as well as this person's linguistic research, which has focused on the intersection of language and race, with particular focus on how language can be used to disrupt racism and other forms of oppression. So very interesting topics. If you enjoyed today's content, be sure to hit that subscribe button, leave a review, and share this with someone who gets some value from it. And if you're watching this on YouTube, leave a like as well. That really, really helps. These are really the best ways to get the show out to more people and really show your support. So be sure to subscribe, leave that review, and share it with someone who gets some value from it. I appreciate that, and I hope you enjoy the show.
Hey, this is Julie Sweetland. I'm a sociolinguist and a senior advisor at the Frameworks Institute, and you are listening to Public Health Careers.
Today, we have a sociolinguist who focuses on how small differences in language have big effects on the world. Her linguistic research is focused on the intersection of language and race, with a particular focus on how language can be used to disrupt racism and other forms of oppression. She is a strategist who sees and seizes the possibilities for impacts. She conferred a Bachelors in Linguistics at Georgetown University, then conferred a Master and PhD in Linguistics at Stanford University. She currently works as a senior advisor at the Frameworks Institute. We have Dr. Julie Sweetland. Welcome to the show.
Thanks. Thanks so much for having me.
Truly, truly is my pleasure. I'm excited to have this interview and to hear more about your work. So let's hop into it.
Let's
How
do
do you
it.
identify? Yeah, of course. How do you identify and then tell us a little bit about your personal background?
Yeah, absolutely. So my pronouns are she, her, hers. I am, my family of origin is white. My family of choice is Black. I am a white woman, definitely from the Midwest, and grew up in the '90s. So you're the millennial. I'm the Gen Xer on the podcast today, and all of those things. Growing up working class, being a first generation college student at some fairly elite institutions of higher education, all of those things definitely shape my perspective and positionality as I work on important health equity issues.
I look forward to hearing more about that and just hearing a little bit about your bio. I'm curious, like as a sociolinguist, talk more about or give examples on how small differences in language have big effects on the world.
Oh, good question. So sociolinguists study language in society. And, just as a biologist would use their tools and disciplines to understand life in different settings, we have our ways of looking at parts of language all the way from different sounds to, entirely different ways of approaching conversation and discourse, and how that connects to different social identities, different regions, geographies, all those sorts of things that make up society. So I could talk about, I could give you lots and lots of examples of how small differences in language reflect who people are, reflect how they want to be seen, what they're trying to get across, and how those differences, if we're thinking about them in terms of policy communications, really make a big difference in the world. But in prepping for this, I started to think about some in public health in general that are really important. So I remember one study we did at the Frameworks Institute, where I work now, where the project was around ensuring that more pediatricians were able to ask, assess, and advise young people about whether they were drinking alcohol, smoking commercial tobacco, or using marijuana or other drugs, and be able to give them advice about how that might affect their developing bodies and brains. So the intervention that public health had recommended was SBIRT, a fun acronym: screening, brief intervention, and referral to treatment. We knew we couldn't call it SBIRT in our studies as we were looking for different ways to explain this issue to the public. And so we wanted to find a word to describe what was happening, which is a doctor talks to their patient at their annual checkup and says, "Hey, can you tell me a little bit about, if you have ever had a drink, have you had a drink in the past month?" And depending on what the young person says, they would respond. And it's very supportive and non-judgmental. It's motivational interviewing. So we tested a few different ways of talking about this. That physicians should screen adolescents for alcohol and drug use at their checkups. People rejected that idea because they thought it was like drug testing, right? Biological samples. That sounded like way too much, for your annual physical. They said, what if we said physicians should ask the youth about drug and alcohol use? Still, they thought that the purpose was to catch them, punish them. But if we simply said physicians should have a conversation with young people during their wellness checkup about alcohol and drug use, then people actually imagined what the public health intervention was, right? They imagined the doctor having, again, a non-judgmental conversation and giving the young person some health information that they could use to better, their health journey. So that, just difference of a couple words can make, really a big difference in how people understand, interpret, and react to what we're talking about as public health professionals.
That is very important. And I think we don't think about how important language is and the use of language, especially in when we're trying to relate with different populations. And so I'm glad that you're doing that. And thanks for highlighting the point of like the screening and I think a lot of people would comment it and, oh, that's punitive. You're trying to get them in trouble. But then at the end of the day, like, it is something to protect their health. And you have to understand all the factors, and being able to ask them in a way that is going to receive the best response or the most honest response, I think is very important as we're thinking about preventative ways that we can impact populations.
For sure.
Also, I know that you have like framing as an important career skill set for public health people. So firstly, please highlight what framing is and highlight how this could be an important skill set for people in public health.
Yeah, strategic framing is making conscientious and goal-oriented decisions about what to say, where to start, how to explain it, what to emphasize, what to leave unsaid. So if we can, as public health professionals, again, be very conscious and intentional about what we're saying is the beginning of a problem, right? What's the root cause? Where do we start our explanation? How do we talk about solutions? Do we talk about them only in terms of individual behavior change? Or are we helping, our communities and our constituencies understand that many of the public health problems and before us can only be solved in a collective fashion? And so any of those decisions are framing choices. And it could not be more essential to public health. I did not come up as a public health person. That wasn't my initial, undergrad or graduate training. But I found my way into it in the last 5 or 6 years, and have just really been struck by how pertinent it is to think about language and clear communication in order to accomplish any of the things that people are trying to accomplish in public health.
It couldn't be more apparent how important communication has been over the last few years, especially during the pandemic, and how important communication was supposed to be. And I think the missed opportunity that public health had to really meet those populations and really communicate with them in a way that they would be will to take action in a positive way to improve their health, which was not the case for many populations during the pandemic and continue to be not the case for many populations. And it's really interesting to hear you talk about framing is even thinking about what is the root cause. And I think about this a lot because even in like the COVID example, it was what was the media telling us about COVID-19? What was the framing around that? And then how did that change our perceptions of COVID-19 and how we acted and the health behaviors that resulted because of that? And once again, like just highlighting how important it is to understand and be intentional in how we talk about issues and how we talk to certain populations, because those kind of conversations can have both positive and negative consequences depending on how those conversations are had.
Yeah. I mean, I think from the very beginning, we can see how traditional, conventional public health habits of naming a virus from where it is first detected, right? So at the very beginning, we're used to calling it COVID-19 now, but at the very beginning, people were calling it the Wuhan virus
Yeah.
or the Chinese virus, and that came out of just a neutral historical decision, right? About you name it where you found it. That kind of language was quickly weaponized, right, and used to create fear of other, to create a sense of it being distant and far away for us here in America, to be able to lay blame, right, on a certain population, a certain understanding of, and so anti-Asian bias. So that sense of, being strategic and thinking about not just what you're saying and why you're saying it, but what are the likely effects of saying it that way? And how might it be misinterpreted or misused? I think that is one lesson that we could all take from what we've been through in the last few years in public health. But public health has been conscious and savvy about framing, long before this kind of most recent iteration of what we're up against. If you think about, kind of the biggest one of the biggest public health wins of the 20th century are great strides in prevention and control of tobacco, and tobacco related harms. That was because public health advocates very conscientiously reframed the issue from a personal vice to talking about cigarettes as a defective product that was being intentionally manipulated by corporations to create harm, and moreover in specific communities, right? And so that really had changed what people could see as appropriate regulations, as appropriate government action, and really as appropriate public, personal behaviors and choices. So that shift in the frame can have, really cascading positive effects on public health. But yeah, as you said, there's plenty of examples where, unintentional, haphazard, or sometimes badly intentioned framing can really have some negative effects.
Yeah, so when you're thinking about issues and thinking about working with population, it's definitely important to think about that frame and how would this population view it, and is it something that's going to
Yeah.
be beneficial in the long run? And so just being intentional about that. So I appreciate that. And you said 5 years ago or so
Yeah.
you got you weren't traditionally into public health, but now you see yourself doing some work that is public health related. Can you talk more about that story?
Yeah, absolutely. I mean, so at the Frameworks Institute, we work on a whole lot of different social issues. As I like to say, you name it, we frame it. But really, it's just that if when partners come to us with mission-driven partners with a strong evidence base, and really, an evidence base that points to progressive policy change in lines with our values for equity, that then we'll work on that issue. So I had been working quite a bit on educational issues. My background is in education reform, and a lot of early childhood issues. I happened to be staffed to a project that we did with Change Lab Solutions in partnership with the Centers for Disease Control Office on Smoking and Health, where the then director said, "Sure, tobacco control is one of the public health victory stories of the 20th century, but we need the 21st century frame, because what was once kind of an equal opportunity killer is now the health harms are concentrated in racialized and marginalized populations. So communities of color, but also people who are LGBTQ plus, rural people, people of low SES, low socioeconomic status, and people with serious mental illnesses. And so, and if we just start talking about these groups, right, are quote unquote still smoking, right, that is going to reinforce a faulty sense that some populations have higher health burdens because they're making poor choices, because they don't have the right values. And so before the CDC and the many national partners who support that work even wanted to start telling a story about disparities, they said we really need to get the framing right. So in that, I just fell in love with the public health perspective, with the sense that health is so foundational, right, to anything we want to accomplish, as individuals, as families, as communities, as society, that what surrounds us shapes us, and that we can shape what surrounds us. And I saw what I added to the really strong set of policy analysis, policy implementation, um, evaluation, community engagement. What I was able to add to that was a sense of how our language shapes what we're able to do. So that and just the intersection of the issues. I shared a little bit about my background and just being able to see how common cause, multiracial coalition, multi-identity coalition, really working deeply in and with their, their own communities, but towards a shared policy solution. I just found really inspiring and motivating, and have, since kind of my portfolio at Frameworks has been in public health primarily for the last 5 or 6 years. And 2017, 2018 turned out to be a good time to start to learn public health because of what happened in 2020. And so was able to really, use some of what I had learned to help folks through some of the pandemic related communications.
Yeah, and this goes right into the next question. So, what does public health mean to you?
Oh, well, I don't know if I have a different answer than what I just said, but I can talk about I mean, it's just the understanding that health happens where we are, that health is a product of our collective decisions as a society. And so understanding what those decisions are, what are their consequences, intended or not, and how can we make better decisions at a collective level to ensure that we can all thrive. And so really taking a broad look at environments, built environments, social environments, any of those surroundings, right? And really trying to use science and evidence to get those environments to be as healthy, supporting health, well-being, thriving for everyone. And I love that we have taken that big concept of, human flourishing and set up an infrastructure. Sure, it could be more robust, and sure, it could be better staffed, and sure, but we have local health departments and state health departments and, national partners and NGOs that are all taking that perspective and bringing it, to bear on people's lives every day. So that's what it means to me.
Yeah, absolutely. And I think we have to appreciate what we do have in public health and work towards all the things that we need more of. But just highlighting your point of like language shapes how we deal with health and really framing how language is talking about not individual issues, but societal issues and systemic issues, and really highlighting that different change in framing so that we can work not to think about how do we fix that person, but how do we fix the system that person is in, which I think is an important frame shift that we have to have in public health, especially if we want to get to systems change and equitable systems change at that.
Mhm.
So you have your bachelor's degree in linguistics and you got it from Georgetown University.
Yeah.
Tell us about that thought process. Was linguistics the thing that you went into your bachelor's degree wanting to do, or talk to us more about
No,
that?
no. I mean, I really loved languages in high school. I didn't go to the most academically robust high school, but where one thing I could do is, I mean, I took French and Spanish and German. I took all the languages. And I was like, I want to go to college and major in a different language with a different alphabet. And so, and again, I'm a first generation student, college student. I did not have anyone advising me. I was like, okay, China seems really far away. Russia seems really cold. Arabic. I'm going to be an Arabic major. Had never been to the Middle East, had no background in that, but that's so I should, so apparently not that many people apply to be Arabic majors. And so I got in but you have to take, if you're a language major at Georgetown, you have to take a linguistics class your first semester, and two overall. And I fell in love with it just right away. I realized that it wasn't so much that I loved language; I loved to think about language. And so that's the distinction. So people often ask me, how many languages do you speak? And people ask lots of linguists that, and I'm like, I barely speak one. I've studied seven, but it's not my thing. I like to think about, what are we doing with English, right? What are we doing in English? How are we languaging? And what does that say about us? And what is that going to do in the world? So I fell into it in that way, and really paid attention again as someone who was didn't have nearly as much money or a family history of being an academically kind of strong person as a lot of other folks on campus. I was thinking a lot about educational equity then, and did a lot of work as undergrad, focused my attention as an undergrad about how teachers understand and think about American dialect. So if you are a Southern person, if you are a person with a language with an accent that suggests that your first language isn't English, if you are a person who speaks African American vernacular English, if any of those accents can be really stigmatized in the classroom, and children's potential is underestimated, and with the low expectations comes disengagement from school, and that whole kind of chain of events. So that's what caught my attention as an undergrad, and I think that thread has kind of followed me throughout my career.
Well, that's awesome, and I think it's cool to hear the story of you thinking that you want to study language, and then within getting there, you understand like there's this thing about linguistics and being able to actually study languages, but not study languages and
Yeah.
like learn languages, which is interesting in itself. And I always think back to, because I did my last 2 years of high school in the Middle East, and it
Oh.
was in an international school,
Uh-huh.
as well as I took Arabic in university for a year and a half. I do not remember much of it, but funny tangent once again. But I remember in one of my classes, because there are students from probably like 50 different countries in my class, well, in my school, and in my class we were making fun of, or someone was making fun of someone's name and how it was said, because we were reading out from this text, and the teacher just stood up and was like, you guys need to stop this. You guys come from all different places around the world. Like, there's no need to make fun of someone's name,
Yeah.
because anyone can consider each one of your names funny, but there's
Mm.
nothing in that. And I think that stayed with me, because it's very important, because especially as humans, we identify with our names. That's something that's beautiful to us in many different ways, and just to like honor that in someone, I think is the least that you can do in kind of like understanding them and reaching them, and treating them with humanity and respect. So I don't know where I was going there, but that's what
Well,
that reminded me of.
you were going right where to a beautiful place. And it just, I mean, that was one of the things about linguistics that I fell in love with then, and I still love. It's a way of looking at humanity and the things we do descriptively, simply describing what is without putting a value judgment on it, right? And understanding that one of the things that unites us as humans, language is universal, but the way we language is infinitely diverse, right? And reflects kind of all kinds of different ways that people show up and live and represent their selves. So that's, yeah, definitely in line with with what I was thinking about as an undergrad.
Okay, awesome. And what does studying language, or the way that we language, look like? What does that look like in theory or in practice?
So, I mean, I did a lot of audio recording of natural conversations. There are lots of ways to do it, right? Just as within biology, you've got everything from being in a lab and doing experiments to, going off to some very different ecology than your own, and plopping down and just watching, the critters and plants that are coming by, right? Just as vast a range of methods in linguistics. You can take ancient texts from languages that are no longer spoken and see if you can reconstruct how language has evolved from ancient Sanskrit to modern, Hindi. So there's all kinds of sub branches. What I did was a lot of conversational and applied sociolinguistics. So how do people talk in natural settings? What can we learn about that, about social groups, about how we construct identities, how we value or devalue different people? And again, one of my, I think you mentioned in the bio, one of my focus areas was how are teachers pushing against racism or enacting racism by the way that they respond to Black students' language in particular. And then I expanded that out to other groups in America that have stigmatized dialects. So, interviewing teachers, hanging out in classrooms, watching what happens, looking at how language is and families talked about language with their kids, with talking about the whole repertoire of language that you can have. Sure, we have ways that we talk in community. I want my child to talk such and such a way in school, all kinds of language attitudes. So really just looking at what do people think about language and identity, and how does that impact real stuff like your grade in English in fifth grade, right? Whether or not you think you're a good writer, do you think your teacher thinks you're a good writer? And those sorts of things that really can make a difference in a child's academic trajectory.
Yeah, well, I appreciate you sharing that. And so, but before we go into your PhD and your master's, which you got in linguistics, were there any like undergrad takeaways or experiences that you wanted to share with us?
I think that was a place where I started to think about having an academic discipline and a real world connection, right? And then it was important for me to do both, right? I needed to be able to talk about phonetics and phonology with the most formal of formal linguists, and I needed to be able to understand what that theory meant in the context of a practical setting, like getting teachers to view their students with a more holistic and humane lens. So that back and forth, and also just the value of doing research as an undergraduate, I think was something that I really took to heart at that point.
That makes sense. And did you know at that point in time that you wanted to get a PhD, or what was that thought
No
process?
way. Oh my gosh. No, I was a first generation student, as I said. And it's like, wait, more college after college? Like, why would I do that? But I had been doing a lot of volunteer work and other public service work. And I ended up getting the Harry S. Truman Scholarship, which is the nation's living memorial to President Truman. And it is a significant scholarship for graduate level studies for folks that want to enter public service, broadly defined, doesn't have to be government, although many Truman Scholars are in government. So with the process of getting that scholarship, that kind of opened up thinking about grad school and a whole lot of resources around advising and career path advice and those sorts of things. So if you had told me again, senior year in high school, that I was going to go, not just for a college degree, but for a PhD, I would have not even known what you were talking about.
Understandable. We live and we learn. We live and we learn.
Yeah.
So how did you hear about that scholarship, or like what was that thought process for you saying, okay, I kind of better understand linguistics. I want to know more about this. I want to dig into it in a master's and a PhD level.
Yeah. I thought a lot about different things I could do with that scholarship. I mean, the process for it, many of those high level competitive graduate school scholarships. So it's in kind of a class with like the Rhodes Scholarship, the Marshall Scholarship, the Truman, Gates. Gates wasn't around then as a scholarship, but those kind of, often there's a campus officer, right, who's in charge of, they send out a letter to everybody with a certain GPA, hey, you might want to think about this. That one caught my eye because of its emphasis on public service and volunteering. And then, quite frankly, the fact that I was from a lower population state made the college think, oh my gosh, this person could have a chance because there's like a couple scholars from each state. And so it's it was like many things, a crossroads or an intersection of kind of being prepared, right? I had the high GPA, I had the track record of doing the public service events, and then luck or somebody else's agenda or need, right? I was from Indiana. So, I could, so that made me more competitive and that looked good for the school. So they put more resources into me. So that's how that happened. And the Truman Scholar Foundation has been a wonderful support. I mean, through grad school, they're awesome. I, mentor now and do different things with them now. They're a really, really great organization. And anyone that's thinking about getting graduate degrees in public health, if you are a sophomore or a junior in college, it's a good time to start paying attention to that and pursue those sorts of scholarships. But was it so that's how I found out about the scholarship. And then I thought about a whole lot of different degrees. I was thinking I might go get a master's in social work. I might go further for education. And the big piece of advice I got was, there's a lot of educators in the world and a lot of people with an education degree. There are way fewer linguists. And if you have this passion, this interest, this research capacity, I would advise you to do that. You can always you could still pursue educational interests. And then also think about the advisor you're going to work with. And so I got, a strong recommendation to work with a particular professor at Stanford, John Rickford, who is an amazing scholar in his own right, but a fabulous mentor and takes his student advising very seriously. And so it was the combination of kind of some steering and some good mentoring in terms of choice of field and a connection with a particular advisor who really, has his students' best interest at heart and who we wanted to work with each other.
Well, shout out to Indiana, first of
Yeah.
all. And I think it's very important for you to mention that even though that there's that Indiana part of the context, there's that whole other part and the factor of you like actually being a good student
Yeah.
and doing all the other things. So like it is you are creating your own luck in a sense of in a sense. So definitely shout out to you for being able to get that. And that definitely sounds like it was able to open up a lot of different opportunities for you going forward. So did you go into your graduate degree going into a master's program, or did you get a PhD and the master's came with it? Or tell
You
us more
get a
about that.
PhD. Yeah, it was definitely a PhD program. That particular department really doesn't take master students unless you happen to be an undergrad, kind of doing a fifth year or something they call a co-term there. And so I, was admitted into the PhD program after your first qualifying paper, which is kind of a milestone. A couple of years in, you can turn in that qualifying paper as a master's thesis and get the master's on the way. I did that and then took advantage of a Stanford specific verb. People don't drop out very often, but they do stop out, take a little pause and do that. So I took a couple years off after my master's, went back to classroom teaching, and then came back to do my dissertation after a brief time away. So yeah, but it was a package deal for sure.
And reflecting on that stop out, what would you, in hindsight, what were like the insights or the things that you took away from that experience, or just how you approached that experience?
Yeah, I mean, I kind of I didn't start the stop out in the most planful or intentional way. I had actually been having some pretty significant health problems due to overwork and bad ergonomics and stuff. So I just like kind of had to stop. But in hindsight, it was really good that I took a little bit of more time. I think I matured, being out in the workforce again a little bit, and people treat you differently when you are an employee than when you're a student, and so I think it was good for me to have some time as an employee, not a student, and was able to bring some of the experiences from my classroom teaching at that point into the dissertation process. So I think people need to do what what is right for their health, mental health, and well-being. And if I had to do it all over again, I would have taken better care of myself and been more balanced in my first 2 years of grad school, so I didn't have to stop out. But the fact that that was available, the fact that I had an advisor who was supportive, the fact that I was in an institution that really had flexibility and support for that to happen, in the end, made that even that difficult moment be a good thing.
I'm glad it worked out to be a good thing. And it also sounded like it gave you some opportunities to plug different new experiences into your dissertation, which I think is always helpful in the long run. During your PhD and master's program, were there any experiences that you wanted to highlight?
I mean, I think the thing that might be most relevant to folks that are listening to this is, again, finding your allies and your champions in the institution where you are. Graduate school can be amazing and transformative, and it can also just be hard and isolating, and and it can be all of those things at once, right? And so finding the supervisor, the professor, the other folks that can really help guide you through that process, I think is, kind of the secret sauce to thriving, not just surviving grad school. And again, thinking about, your core discipline and your secondary kind of practice sphere, right? So at that time, I'm a linguist seeking to influence and improve education for those that it's not working for right now. In public health, you might be an epidemiologist, or your passion might be, informatics. And so you might have a very specific and technical, discipline, but thinking about the places where that can make a difference and building up an understanding of that world, that scenario, right, would be, I think, the takeaways that I have that I think might be useful to folks that follow you.
And you spoke about like the education and using your linguistic experience and skill set to improve education. And then earlier you spoke about how students or how teachers react to different students based on where they're coming from and their culture and how they speak.
Yeah.
Well, what are some of the key takeaways or maybe like advice that you would give to not students, to teachers in these circumstances so that they are acting in a way that's more equitable to everyone?
Yeah, I mean, I think it's just the idea that people vary their language. Language varies. It is a variable system. And if you are coming at your students with the perspective that there is only one right way to say something, to proceed in a conversation, to write something, you are limiting your own perspective. You're limiting their perspective. You're limiting their repertoire. But if you can understand that it's this big, vast, beautifully diverse system that we can do all of these things with, you can strengthen their skills in, say, standardized language, or more academic vocabulary. But you don't have to erase the repertoire that the students come with, right? If we think about building versatility rather than quote unquote correctness, I think that shift in perspective can really open up a lot more trust with your students, and a lot more buy-in from your students in expanding their full repertoire.
Love that, love that. And I think back to another time for myself, in because I also come from Trinidad and Tobago, and we speak and write British. Well, we don't speak British English, but we speak a dialect
Sure.
of English,
Yeah.
but we write in the British way. So one of the things when I moved to the Middle East and I went to American International School is that color, you don't use the U anymore. And
Uh-huh.
in talking to my English language teacher, she was like, you can write it either way, just be consistent throughout your entire essay. And I think like that kind of speaks to what you're trying to get at there. It's like really understanding that people might be coming to things from different places, and just understanding and working with them to understand that there's no like one exact correct way, but there might be different ways to approach it.
Absolutely. Which really has, I think,
Awesome.
real insight
And
to
then
the way we work with communities in taking up, right, the latest kind of, public health policies or insights. We can have kind of a core thing we're trying to accomplish, but there can be so many different ways of accomplishing it that will work again with the, you have to think about where folks are coming from and what they've got, and then think about what they've got as assets, not problems to be fixed.
Yeah, absolutely. And that asset based framing of conversation and of talking about quote unquote issues,
Yeah.
or opportunities, I guess you would say, in an asset based frame is important. I think that's something that we should look forward to doing more of in public health. So, after you've completed your PhD and your master's degree, you became Director of Teaching and Learning at the Center for Inspired Teaching. So, how you come across that position and what did you do in it?
Yeah, so I actually, my dissertation had me in classrooms. I was doing my field research in elementary schools, and I was just like, I miss teaching so bad. So my actual first job, I was the crazy person who got my PhD from Stanford and went back to teaching fifth grade. So I taught for a year, and I loved it, and I realized, whew, being in schools is tough, and I wasn't able to have the kind of research perspective that I wanted. So I found I was actually looking for a professor position at the local universities in DC, and saw American University had a partnership with this place called Center for Inspired Teaching. I was like, that sounds like a center I would like. And it was really so much in line with my commitments to holistic education, progressive education, student-based motivation, all those, intrinsic motivation. Actually started out as director of research and was doing classroom observations. At that point, I got to visit every public school building in Washington, D.C., which gave me just an amazing perspective on, as I told you, I started off very sensitive to issues of educational equity, and man, did that bring it home. Just seeing the wide range of resources, facilities, teacher quality, emotional tone, right? That happens from one corner of the city to the next. And very much based on the race, class, and language background of the students that those schools were serving. So I did that. I ended up working to help that nonprofit become the first, at that time, the only local nonprofit to be able to prepare and educate teachers, like do support licensing like universities do. And so that's what was in the director of teaching and learning at that position.
That's cool to hear, and it's always great to hear like someone say like I wanted to work. Well, first of all, shout out to you for getting your PhD from Stanford and then going back to work in the fifth grade. I think that in itself is awesome, and that must have been an experience for you. And then that I think like that helps to inform how you move forward from there. But it's important to just think about how is teaching happening and how can we be at the forefront of researching and implementing things to make teaching better. And I could only imagine the inequities or the disproportionate disparities that you've seen going to all those schools in DC, and just because especially considering that a lot of the schools, well, all the schools that are funded through property taxes for a big percentage of their funding, and we know how that works out with redlining and all the other
Mm-hmm.
issues, and how that comes up and shows up in those different students and student bodies and populations.
Yes, and as you know, education is one of the drivers of health, right? One of the what's called the social determinants of health. Pretty often, although linguist says, "Let's kill that phrase off the show." It's it's a it's a widely it's a vital concept and a terrible message. People think it has social determinants of health has something to do with socialism, or it's taking away people's agency because of determinism. Talking about where people live, work, and play, affecting their health is much more user friendly. But how did I get to that? Yeah, so education as a social determinant of health. I mean, it was just so very clear, I think, at that point that, those early experiences can really, again, be transformative, be a force for helping folks kind of break through inequity, or it can really cement and reinforce just, some really problematic hierarchy in society.
Yeah, and hearing you say the social determinants of health, because I know I'm in North Carolina, and I know statewide we prefer to use social drivers because I
Uh-huh.
think they did a survey and exactly what you're saying. People think it takes the agency
Yeah.
out of making those decisions. It's just something that kind of happens to them. And it was interesting. I have public health happy hours where I just kind of have like people come together every month,
Ooh, how
most
do I get
months,
invited to
and
that?
I can send you the invite because yeah, it's just like conversations just like this.
Yeah.
And one person was a health educator in Florida, and she was talking about recently because of the Florida government, they're changing. So social determinants of health have changed to social and economic barriers, so they can't say social determinants of health, and they can't say health equity anymore. They have to
Yeah.
say quality of life. And it's just interesting going back to the point of like how language
Yeah.
shapes and forms how we think and act on different issues, and just how governments and power structures can use different languages or suppress different languages to kind of like help us or take us away from thinking about language or framing language in a certain way, and just how important that is.
Yeah, that can't say health equity anymore is one of the things that's keeping us up at nights here at Frameworks. And I have worked with several states to develop a definition, well, to be able to talk about the concept without using the word. And so, talking about making sure that everyone has a full and fair opportunity to be as healthy as possible, or even a fair and just opportunity, if you can get away with that. I don't know if you can get away with that in Florida, but a fair and just opportunity to be as healthy as possible, which requires valuing every person and their health, improving social conditions that can harm people's health, and working with different groups in specific, sensitive ways to address health issues that affect them and their community. So, like, that's getting that patient centered, person centered idea into it. It's getting the idea of social conditions, shaping it. Not as It's not as sharp as my preferred definition, but that certainly has been something that folks in states where we're getting these gag rules, right, on talking about racism, and other forms of structural marginalization. It's being helpful, I think, to some folks in those settings.
Yeah, and thank you for sharing that definition. Maybe some people, health educators in Florida and other states that are having those gag rules, can take that definition and kind of work with it because, as you said, it really is important to encapsulate what these words mean. And even if they tell you can't say this word, there are other ways at getting at the problem that the words are trying to talk about.
See, that's why public health needs a linguist.
Absolutely, I absolutely agree with that. And after your directive research and then directive teaching role, teaching and learning role at the Center for Inspired Teaching, you moved on to become a professional lecturer in linguistics at Georgetown University.
Yeah.
So tell us about that experience.
Yeah, well, I was actually doing both at the same time. I was adjuncting at Georgetown. So professorial lecturer is code for adjunct. But it means, you actually have the PhD, and you are qualified to be a professor. You're just not like a full-time professor there. You haven't gone through that tenure track process. So I was teaching one class a semester for, I don't know, I did that for a while. Typically language and education, or linguistics and education. Sometimes I would teach introduction to sociolinguistics, or introduction to linguistics, and was often working with, sometimes with undergrads and sometimes with master's students who were pursuing a master's in language and communication, or sometimes a master's of arts and teaching. So I think that was just one way to kind of just stay grounded again in my core discipline, make a little extra money, and as you may have noticed in this story, I really love teaching, so it was great for that as well. In the course of working on that project, as well as setting up the teacher licensure program at Center for Inspired Teaching, I was looking for different metaphors on education. I could see that many of the metaphors that were just deeply embedded in the way people talk about teaching and learning were problematic. Everything from like talking about students like they're plants, and like pictures of little kids as plants, and we just need to water them and they grow, nurturing or cultivating kids which just makes the child very passive. That's my problem with that metaphor. I'm all for nurturing children. Or teachers being on the front lines, which is very like, well, who are they fighting? The students, or
Mhm.
teachers as like superheroes. There was like a Time magazine, I think, then with literally a teacher like with the Superman outfit on, soaring to, save children, which I'm like, we don't need to rescue children. We need to support communities and kind of build well-being, right, and partner in that. So I was looking for different metaphors for education. Again, as a trained linguist, I'm like, I'm not the first person to have this thought. I started to do a lit review and look, for metaphors for education, and I found, which I think will be your next question, I found the Frameworks Institute. They're, one of the things we do at Frameworks is develop and test metaphors that help people understand a complex or abstract social problem in more familiar or simple or everyday kinds of terms. So I found this body of research that Frameworks had done on framing public education issues. And it's 3 a.m. My husband turns over in the bed. I've got my iPad. He's like, "What are you doing?" I'm like, "There's this place. They test metaphors 7 different ways. It's amazing, right?" Going back to all those like nerdy methods that a linguist can use, and it really helped to explain, many of the conversations I had where you're hitting those dead ends and you're like, why are you not getting it? Like, no, health is not just life, diet and exercise. It's all these things. I was having that. No, teaching is not just pouring information into kids' heads. It's kids getting their hands on stuff and working through it themselves. The Frameworks research helped me understand why those conversations were hard and what you could do to have better conversations, and get people to understand some of these more complicated issues. So I started following the organization, and a few weeks, maybe a couple months later, a job showed up in my Google alerts, the director of learning, which involved social justice, sociolinguistics, and adult education. And clearly that was my job. And luckily, Frameworks agreed, because otherwise I would have been stalking them for about 11 years, which surely would have gotten awkward by now.
Well, I love that. I love that. The 2 a.m. search to find the organization that's working on things that you thought was really cool,
Yeah.
getting that Google Alert on, which I think is something that you alluded to, but I think is very, very important for other people out there. It's like, put on those Google Alerts, because you never know when that opportunity is going to come, and just make it easy, make it automatic, so that
Yeah.
Google will do that hard work for you, so you don't have to keep looking, because I think that's very, very important. And yeah, that sounds like really it's really like full circle, and like you like, oh, how can I do this teaching, do this sociolinguistics work, and like really drive forward positive change? And by looking for that, you found the Frameworks Institute. So
Yeah.
you're currently the senior
Yes.
advisor. You started there as a director of learning, and from the director of learning you moved into a VP for
Yeah.
strategy and innovation, and then a senior advisor.
Yeah.
So tell us more about the directive leaning role that you came across and that you were able to get into it. What did you do? And thankfully you got the roles, so you don't have to stalk them for the next
Yeah,
11 years.
yes. So director of learning, Frameworks at that point was a point very known for at the point there are research. It was a research organization, but the research only does as much good as it is applied. And so there, the organization at that point was looking to, not just kind of tell people what they found and say, go do it, but to take a adult pedagogy perspective and really support people in learning, understanding, and implementing, effective evidence-based framing strategies. So I think I was ideal for that position, because of my understanding of not just the nuances of framing and language, which I had from my core discipline, although we have lots of disciplines at Frameworks, political scientists, anthropologists, and public health people. So we're a diverse kind of staff, in terms of disciplines and academic background, but certainly language is cuts across all of them. And then my secondary discipline of education, and particularly adult education, I've been focusing on for some time with the teacher preparation and professional development. And so that role was to build out a curriculum to really think about if we need folks in education reform right? To stop talking about education in ways that makes people look to an idealized past, or makes people think that the disparities are because, again, communities don't have the right values, or those sorts of things. How do we need to talk about it? And how can we get those advocates not just say, yes, I should do that, but feel equipped to actually do it? And so that was that role. From there, as the organization was growing and that curriculum and was more established, other people could take that work on. And I was, looking across the organization to think about how could we be more impactful by trying something new and different from what we've done before. So that was the VP for strategy and innovation role. At that point, I did that for a few years, and then just some changes in the organization as well as some changes in my own life. I had different personal responsibilities. I wanted to do committed to the organization. I love the mission. I didn't want to go anywhere else, but I needed not to be managing people. So I could really focus, just have better work-life balance. And so the senior advisor role, I tell people I'm in charge of random important stuff, but no people. So it's just it's a made up title for that kind of role. And again, it's having, being able to advocate for yourself within an institution to say, I can do this and I can bring this value, but I need this kind of container for me right now. I need this kind of support. And I think that in terms of building a career is really important.
I love that. And I think that that's ideal to think about, okay, yes, I want to work with this organization, but I also want more of my family life back. And what does that look like? And trying to work with the organization to do that. Because many times I think we are afraid or we're scared to like share like, hey, we love this work, but we don't want to be managing people, or we don't want this much responsibility. And some people might even look at it as a step back, but it is like a step forward in your family life and all the other things that you get to do. Because one thing that I always like to advocate and say is that we're more than what we do in our jobs, and I think it's important to have different focuses and have a life that's full of different experiences, and whatever is important to you, you are able to do more of that for yourself.
Right. Well put.
Awesome.
Huh.
Thank you. And then earlier on, when you said you were looking at 2 a.m. in the morning
Yeah.
at Framework Institute, you're talking about how they were using language and like testing. I think it was 7 different quotes or things to explain
Yeah.
education at that time.
Uh-huh.
What does that look like, testing language? Is it just that
Yeah.
you come up with different phrases and then you have focus groups of people, or what does that look like?
Yeah, it's a great question. So I'll speak a little bit from the tobacco disparities project that I was leading for the last 5 years or so. So there, we had some big ideas of what we needed to shift, from, like, we needed people to understand that that smoking and commercial tobacco is very deadly. It's the leading preventable cause of death, and that it's not just an individual behavior, right? That it's shaped by the policies and programs that are in place. We wanted people to understand that it wasn't affecting everyone equally anymore, and we wanted to do that in a way that fought against bias and stigma, and reduced bias and stigma against the groups that it's affecting. There's more to the project. We know we needed to shift those ideas. So some of the things we did was we tested different value statements. So we tested one that was about progress. The tobacco control policies have come a long way, but we still have kind of this last mile to go to eliminate disparities. We tested another value that was much more about justice, that a just society ensures that nobody is exposed again and again to things that we know cause harm. And that means we need to think about how we're exposing folks to commercial tobacco advertising and products. So, we tested those two head to head we tested them for their effects on whether or not people would support equity focused tobacco control policies. So, would you support dedicating revenue from tobacco taxes to communities, right, that face the highest levels of tobacco advertising, exposure? Would you support reducing the number of retailers, right, in a particular area that sell tobacco? Would you support saying that, no tobacco advertisements can be placed within 1,000 feet of a public school, which would have a really outsized positive effect on Black and Latino children, right? So we test, if I talk about progress or I talk about justice, which one of those gets more Americans to say, let's do the equity focused thing? As it turns out, on that one, justice was the most powerful message. So we recommend that. We then also tested a metaphor and we came up with several of them. We said, do we talk about, as you mentioned one earlier, barriers or roadblocks to achieving good health? Or could we talk about the pressures on communities from not only tobacco advertising and marketing, but unemployment, economic distress, discrimination. And so that pressure metaphor helped people to think about the traditional drivers of tobacco use and exposure, as well as being able to bring in a story around structural racism and marginalization of people of different sexual orientations or gender expressions and people with different behavioral health conditions. So that pressure metaphor is one we have developed. And then some other strategies around never raise a disparity without explaining where it came from. If you just say LGBTQ youth are 2.5 times more likely to smoke than their straight peers by age 13, you haven't explained why. And so people will often fall back on their stereotypes of that group. Oh, kids will be kids, teens will be teens. Maybe they're troubled and that's why they've got all this stuff going on. And so if you say those youth are likely to experience higher levels of stress from social isolation and discrimination, this helps to explain why they're 2.5 times more likely to have smoked by age 13, right? That's a very different type of story. And so again, we're testing those things empirically. We're developing the ideas based on what we see the field doing and what we think might work, but we wouldn't just say, we like this one better. We're testing them empirically in quantitative and qualitative. So like focus groups and large scale survey experiments are our two main methods, although there are more.
Yeah, well, thank you for sharing that. That is important. And I can imagine why you're seeing and you're advocating like public health needs more linguists. I would agree with that because it is so important to get that language right and to frame it in a way that is going to be most helpful. And to your point just now, it's like you can't just say that there is this issue without giving that root cause, because then it leaves it up to other people to create their own assumptions. And many times the stereotypes kind of fall into that and it just perpetuates that issue as opposed to explaining, okay, these are the reasons, the underlying causes for this issue, which I think is important and something that I will be thinking about a lot more as I do work in this public health field. So I appreciate you sharing that.
Yeah, thank you. I mean, the issues we're working on are too important to leave the framing to chance, right? And we see that guesswork or gut work, like what do I feel the most, right, has just, I can show you bar graph after bar graph of what you think you're saying is not what people are hearing. And so, that empirical approach that we take so seriously in public health policy analysis, I think we need to take just as serious an empirical approach in our communications analysis.
Absolutely. And then before I move you on to the Furious Five, I would like to ask, where would you like to see yourself in the future?
Oh, on a beach, I hope. No, you know what? I probably shouldn't say this on a career planning podcast, but I don't have a 5-year plan or really any career plan. I have values that I work towards. I have commitments. I have interests. But I think that, if you work to those values, commitments, and interests, you are prepared, to take advantage of serendipity. So, I think I told a couple stories where it was luck would have it, but I was prepared in a space to take advantage and notice, right. And seize those things. So I don't know. I just want to see myself doing more work, around these values and commitments, with the right life balance and great colleagues. And right now I assume that's still frameworks, but who knows what could happen? Life is long.
Life is long. Life is long, and I
If you're
love
lucky.
that answer. And
Yeah. Yeah.
yeah, absolutely,
Mhm.
absolutely. But yeah, having a values based career is I think is important, and I think it just allows you to really have a career or like a life that is more expansive than just focused on this one specific goal. But just knowing that these are the things that I care about, these are the things that interest me. How can I make all these things work in my life to the best of my ability? I think is an important and good way to frame it. So I appreciate your answer there.
Thank you. All
And
right,
then
Furious 5.
moving on to the
Oof.
Furious
All right, go
Five.
for it.
Number one, what advice would you give to a student trying to pursue a career in public health?
Pick your advisor and your program carefully. And again, think about your core discipline and a place that that work can be most valuable, and learn about the inheritors of your work. You've got to be able to not just give; you have to understand where it will be taken up, and be able to bridge across those two sides of an issue.
Number two, if you're talking to someone wanting to get into your position, what advice would you give them?
Oh, frameworks is a great place to work, and the what we're looking for is, again, folks who can take a social science empirical approach to a social problem, to analyzing the communications aspects of a social problem, but make that empirical kind of nerdy analysis relevant and actionable and practical for folks who are trying to drive social change. So I would be working both sides of that equation.
Great advice. Number three, what's something you're working on improving in your life right now?
Oh man, what's something I'm not working on? I am a life hacker. I am always have some sort of self-improvement strategy. The one that is the biggest challenge for me right now is getting work product out for feedback sooner. I tend to hold things until I think they're perfect and don't want to give them up until I think they're perfect. And then that makes it harder for people to collaborate with me, and for me to get input that would improve it. And also just means I'm always feeling like, I gotta do more. So I'm working on time boxing. I'm gonna work on this for an hour, for 2 hours, for a day, and pass it on to get feedback on wherever I am.
Love that. And that's great advice for anyone that we can all take it and improve our work as well. Number four, professionally, do you recommend anything?
Oh, like a book or a podcast or something, or just a life recommendation? Uh,
You can
Oh,
do
Gov?
both
Okay.
if you like.
So a book I'm loving right now, I mean, I read it a couple years ago when it came out, and I just keep like turning back to it for examples as I'm teaching or working with partners. It's How Change Happens, Why Some Social Movements Succeed While Others Don't, by Leslie Crutchfield. I'll put it up here. It's really, it goes through different social movements, tobacco control being one of them, the fight for marriage equality being another, ones that have happened, more or less in recent, American history, and really talks about the inner workings. What are the effectiveness factors that allow some movements to succeed when there are plenty of movements that should be succeeding, right, based on the cause, and they don't necessarily break through. So I like that one a lot. And then I think the book that's had the most effect on me, um, just in terms of like logistics of professional stuff, is Getting Things Done by David Allen. It's just like a way to think about your to-do list and your priorities in a way that's both big and holistic and values driven, and like very practical, like what do I do next, and I've only got 5 minutes, like how do I make use of this 5 minutes. So I love that one. I'm a little bit obsessed.
Awesome. Well, I appreciate that. And I'll be sure to link those in the show notes for anyone that's interested in checking those out. And then last but not least, where can people connect with you, Julie?
Oh, well, I very easy to find on the Frameworks Institute website, frameworksinstitute.org. You can find my email there. I am on LinkedIn, and I'm still on Twitter. Although by the time this airs, I might not be. But I'm around on social media. I don't post a lot, but I do anymore. But I am there. So yeah, Frameworks and LinkedIn is where you can find me.
Awesome. And I'll be sure to link those in the show notes as well.
Right.
Well, thank you so much, Julie, for coming on and sharing your insights and expertise and story. It was quite a fascinating journey, and as well as like I learned a lot.
Oh, Amari, thank you so much, not only for interviewing me, but for this podcast. It's just, I mean, I wish I had had something like this, when I was getting started, to just kind of get into the mindsets and the backstories of how people get where they are. And it's just such a democratizing way to do it. You don't have to be the person who has the connection to get the informational interview, right? You're putting it out there for everyone. So I just love that. And thank you for doing it.
Well, my pleasure, and thank you for being a part of the archives of great content and great stories that people can rely on to find and navigate their public health career journeys.
All right. Appreciate you. Bye for now.
Awesome.